Hi, good morning. Welcome, audience. And I'm Steve Yaskin, CEO and co-founder of Health Gorilla. I'm happy to present to you a fire chat. The title of today's fire chat will be Perspective of the Future of the Hybrid Care. And I'm very excited to have our partners here from one of the leading organizations in the United States on the hybrid and virtual care, which is Amwell. So welcome, Matthew and Cara.
Thank you for having us, Steve. We're excited to be here. Roy Schoenberg, our CEO, was originally planning to be here with you, but unfortunately fell ill, so we can pretend. Thanks for having us. It's a great booth, great location, and looking forward to the discussion.
Hi, everybody. I'm Cara Munnis from Amwell, VP of Product.
Thanks, Matthew. Thanks, Cara, for joining us. We got the best thing in the product. Sorry to hear about Roy, but hopefully we'll catch up soon. We've been partners for quite some time. It was a very interesting journey. Thank you for having us being part of that journey to enable next generation of the hybrid and virtual care in the United States. So my first question to you, what do you see as the key drivers behind that shift to the virtual care? We went through having virtually no virtual care, no pun intended, to all of a sudden everybody were using virtual care in some shape and form during the pandemic. Now there's a lot of talk about plans and payers starting to cut down on that. There's still a huge number of virtual visits that are at some point we're catching up to actually superseding the live visits to the providers. Where are we today with virtual care now that pandemic is over?
That's a great question. So I think there were a number of pretty significant drivers of the move to virtual care. I think consumer preferences, definitely a big one. So COVID-19 pandemic was certainly a forcing function for a lot of consumers to do something they hadn't before, which is, receive care virtually. And I think as time has gone on, consumers have started to it's kind of shifted their baseline. They now expect to have access to that higher level of convenience, that same quality, and we're seeing that grow. I think providers also have started to see real results as a result of these virtual visits. And that has really changed the favorability overall and the willingness to participate outside of just traditional channels. Certainly the innovation that we've seen in different technologies, particularly devices, the ability to do things that previously you needed to have an in-person visit for, that we can now monitor patients' vitals from their home, from bedside. The wearables that are out there today, it brings with it a lot of capabilities that enable new clinical use cases to be covered through hybrid care. I think in addition to that, we've got the rising cost of healthcare in the country, which is a pretty big driver. And then finally, staffing shortages. So the ability for providers to augment their staff, not only increase the number of clinical use cases they can cover, through virtual visits, but also to augment their staff with something offered by Amwell and certain other organizations is, I think, a great source of that, and we'll see a lot more of that to come.
Thank you. That's very interesting. I want to double click on something you just said. When we just started talking about virtual care a couple of years ago, everybody default thinking about virtual care, well, it's just Zoom, right? It's two people talking on a Zoom. How different can it be? And a couple of years down the road now, we are starting to realize it's a whole universe. It's the whole ecosystem of technology that got spun out of that just the Zoom call. How would you describe current advances in technology around, what are the specific key factors that are driving virtual care adoption further and further and further?
That's great. I think for Amwell, Converge is our hybrid care enablement platform that we're very excited about. There are some things that we're investing in. Of course, our partnership, the automated lab ordering, in addition to data sharing, is a huge investment. In addition to that, Amwell itself Our platform connects all of these different offerings, both from Amwell and our partners, to offer clinical services and a whole host of different options. And they're not all these disparate points that you're engaging with. They're connected, and we're sharing data across the experience. And so I think that leads into where interoperability comes in there too, because that is enabling, through these various programs and the technologies that we're invested in, sharing responsibly of the right amount of data from the patient to the clinician, making sure that that kind of longitudinal relationship is well documented and easy to access. I think additionally, the different advancements and investments we're making in devices and device technology, a little bit of what I talked about before, one of the drivers to hybrid care. Amwell is very invested in both our own devices, like carts and TV kits and things like that, but also in the devices that are available from our partners that can extend care to the home, make it more efficient, and I think which is absolutely one of the best things. Finally, I think automated care technology is something that we're heavily invested in. We have the opportunity now to engage patients in between visits, make sure that they're doing things like following up on their treatment plans, taking medications, and things that are coming down the pipe in terms of like diagnosis and treatment, taking some of those administrative tasks out of the hands of people, putting them into machines, making sure that people are actually their time is spent on the things that they're best at, I think are some of the key investments that we're making.
Yeah, very interesting. It sounds like it's a whole universe being created out there. It's not just a phone call, right? And it's very interesting how Amwell is, with the Converge system, how you guys creating this whole ecosystem of devices, software, and interoperability out there. And we always think about hybrid virtual care model as enhancing the relationship between the patient and the provider. Where do payers come into play here? Is that a good thing overall long term? Are we saving money? I totally get we're reducing the burnout with providers. We're creating a convenience level and the level of engagement unheard of before with the virtual and hybrid care. What do payers think about that?
Yeah, so we hear a lot from our payer customers and prospects. One of the first things that they always mention, though, is the recognition that data is so disparate right now in the system. Patients are going down the street to their urgent care center, they're going to their primary care office, they're going to health systems for a specialist, they're going to the ER at times, and there's really no consistent way to bring all of that data into a single place. And so, of course, Health Gorilla is doing a lot of great work there, but it's a big opportunity for payers because they realize that down the road, for the next encounter that a patient has with a provider, they would love it if all that data could be shown to that provider at the point in care. And to further that, we also hear from our payers that they want to be able to influence that encounter. So how can we help them bring their information about a specialist network? How can we help them bring lab networks? How can we help them bring digital care options for follow-on programs and clinical services related to their condition-specific needs into the visit so that when the provider is actually treating that patient, they can see all of these options in one place and make the best recommendation for follow-up. One more thing I'll touch on, because you asked earlier, Steve, is related to expansion of virtual care and related to reimbursement specifically. So we know that payers are not currently covering every single type of virtual care encounter, but this is something that we hear from them. They do want to expand their coverage and their reimbursement related to virtual care. What they need, though, is quality indicators. They need to know that providers are able to see the right information, make the right recommendations for next steps, and that we can track and actually measure clinical outcomes and quality the same way that they can do today in physical care. And so this is, again, something else that I think is top of mind for them that the hybrid care solution actually can enable.
Oh, very, very interesting. The way we think about virtual and hybrid care, it's still a novelty to some degree, right? It did not exist 10 years ago. As this is a kind of a new paradigm in healthcare being created, how does product at Amwell sees data? what's the value of the data in virtual and hybrid care. And by data, I mean ability to interoperate with primary care, with plans, with specialists, with the entire ecosystem built around the patient. And virtual care being kind of a new kid on the block that just came around out of nowhere 10 years ago, that you guys been leading that whole vertical. How do you see virtual care and Amwell specifically plugging into the existing ecosystem of the interoperability of clinical data exchange?
Great question. So we really think much beyond virtual visits at this point. It's really about the full patient journey. And interoperability, I would say, is absolutely essential to hybrid care. You cannot have a hybrid care conversation without interoperability of some type. And so at Amwell, what we do in the product team is we think about interoperability in 3 buckets. One is patient data. And patient access. So how is the patient going to actually get into the experience and see all of those services that they should be shown that actually are covered for them? Let's make sure that the patient, if they're logging in from a mobile app or from a responsive web browser or from a patient portal or health system portal that's provided to them, they're actually seeing the same experience and it's congruent. Then we think about the provider experience, so getting provider provisioning integrated into the same location, or having providers who are coming in from an EHR in a system or an EMR at a standalone provider practice, or even logging in or SSOing from some other enterprise solution. How do we make sure that all those providers have the same tools, adequate tools, available to them while they're treating a patient? That's interoperability at Amwell. And most importantly, it's the clinical data. Again, Health Gorilla being a great partner in this, but making sure that we have patient information available, that we have patient follow-up options available, and that we have the ability to actually send the record, whatever we learned in that visit, back to the HIEs and back to the health systems and the EMRs that they're operating. And just to underscore a little bit, the Amwell product, Converge, is built really to be transactional. If you think about what we're trying to do to help with staffing shortages, we want our providers on our platform to operate top of license. So they need to be able to have the information brought straight to them at the point in care, everything about the patient, everything about the follow-up options to maximize their time with the patient. And we try to abstract away a lot of the administrative pre- and post-visit questions and check-ins using our automated care solution.
Very, very interesting. I'm going to ask a little bit controversial question, right? You maintaining the whole ecosystem of product, kind of promoting this patient-centric environment in which there are partners, there are outside external organizations that are all part of the whole ecosystem. How do you guys see regulatory space as far as the data exchange? There's a lot going on right now in this country as far as TEFCA is coming live in literally months and a half, 2 months from now by end of the year. QHINs are coming alive, right? And we're shifting away from pipe building and screen scraping and all kind of legacy solutions here and consolidating under this uniform trusted exchange framework, which is what TEFCA represents, in partnership with federal government. So there are a lot of new regulations. There's data blocking, there's US CDI, minimum sharing, there's oversharing, there's also Part 2 data for behavioral patients, there's SOTS. So there's all kinds of regulatory, pretty convoluted and confusing environment that TEFCA is supposed to solve, but it's going to take time. How do you treat compliance? How do you treat data? And what would be your advice to your ecosystem partners that you would like to see?
Yeah, so very relevant. Screen scraping, not best practice anymore. We're operating a secure middle layer, of course. Yeah, it does happen. But we obviously prefer a secure middle layer for the data exchange. I think 2 areas come to mind. So one related to HIPAA. So as all of you know, HIPAA, the spirit of HIPAA is that you really shouldn't have access to any patient data that you don't need to do your job. So we're always thinking about that. One example is actually working with our Health Gorilla partners. So when we're integrating a user interface that already exists, we have to think about how do I restrict the information about a patient that a provider doesn't need to see at the point in time. So if they're in a visit with a patient, you better believe that only that patient's information is going to be available to the provider. And then likewise, if the provider is looking at maybe a dashboard of all the different results coming back, well, maybe they can have access to a population level, but we want to restrict it based on the provider organization and the population that they should be seeing and not see the entire ecosystem. So these are things that we put in place regularly. The second area is really related to privacy policy and making sure that we're really clear with our patients about how do we get the data, and when they come into our experience, they're signing that they're checking off the terms of use and the privacy policies, and we're clear in there about what data we have, how we're sharing it, how we're not sharing it, and I think that trust and transparency, of course, is really paramount to making sure that the relationships with providers are always, staying, top of mind.
Thank you for that. As Amwell continues to grow and expand and bring new technologies, bring new innovation, how do you see the partnerships that you currently have with the outside world developing going forward? Matt?
The battery's a little low. Okay. I think, a few things we look at here, thinking particularly about existing, providers that have been out there for a long time. One of the things that we're looking for is a partnership around sharing patient data. And I think that is key. And we, obviously there are the fundamentals, but we're talking about kind of that deeper integration, getting a better information about gaps in care, orders, results. Things that the clinician can use, that we can use to make sure that we have the right recommendations on treatments and next steps, and all the history about that patient and what they've been through kind of is present. And so I think that's a big opportunity. For these provider groups, they have an opportunity to work with Amwell and our hybrid care platform, as I've said before, to augment the capabilities they do have, increase their capacity to handle patients, but also to expand their reach, right? To go beyond kind of the geographic boundary they operate in today, to reach patients, that are more remote, but also to expand the capabilities that they can offer and the clinical use cases they can cover with some of our services. And I'd say the last one, probably more obvious, is just the opportunity for telehealth companies to leverage the subject matter expertise that these provider groups have to jointly innovate and build new capabilities that benefit both providers and patients. So there's a lot of opportunities there, that we're working on together, but there's still a long way to go.
Got it. Let's talk about the future a little bit. Let's talk about exciting things that are coming from Amwell in near future. What is one thing that is the most exciting about you in terms of developing of the new products, new technologies, and of course I'm asking about AI. Right? Let's be honest about it. I've been here 3 days. I've been on so many AI panels, more than I ever been in my previous life in this last 3 days. So it's a talk of the town. There's definitely a lot of discussions going on the Hill right now. It's almost like our government is not yet sure how to bring AI here, so there's definitely a lot of concerns. And when it comes to healthcare, it's a little bit of a panic even at some levels. How do we make AI responsible? And we're not yet talking about hallucinations, we're not talking about scoping, we're not talking about any problems that we already observing outside of the healthcare. We're talking about compliance, we're talking about data, we're talking about privacy, we're talking about protection. So how do we do that without unlocking a Pandora box? We have to be super responsible. And I do hear there's some innovation going on at Amwell as far as AI. We would love to hear your thoughts on that.
Yeah, I think I can cover that a bit of a high level, but I'll say I fully appreciate and agree with the notion that we have to do it responsibly. I think it starts with having a good sense of the end goal, right? Like you can employ it in a number of different use cases, but what are you actually trying to drive? Having a good sense of what those outcome metrics are that you're looking for is key. And so I think a lot of that is starting more internally. So we've talked a lot about, taking the administrative burden off staff. That can be everything from, record keeping and, clinical notes but also some of the things that we're already doing with our automated care programs. How can those be enhanced through AI and other automation technologies? So, building a chatbot-like experience is one thing, but can you leverage AI to build it faster, to make it a little bit more dynamic? I think there's a lot of opportunities there. And then there are things like remote patient monitoring, where you have, back to the staffing shortage, back to an opportunity to serve people kind of where they are, using AI and other technologies to monitor patients, make sure that you're looking at their vital signs, but also looking for signs that maybe they're in distress, they're in a hospital room, the bed rails are down, maybe they've gotten out of bed and they aren't supposed to. There's a lot of things like that that are, we're obviously looking at. Everyone is, it's every other booth here is talking about it, and so we're looking at all the ways that we can leverage it responsibly in a way that drives measurable results, which I think is the key, because there's a lot to get excited about, and there's a lot that sounds very inspiring, but I think now it's time to take that to what are the practical applications that can actually show outcomes.
Absolutely agree with that. Has to be responsible and has to solve initially very narrow practical solutions. We have to find them, and we know what they are, right? And I think that's the way to approach AI implementation. Get outside of the hype cycles and get into solving very specific solutions using AI. Thank you very much. Thank you for having us for the journey. We'd love to be part of your journey to bring better, more enhanced, more advanced hybrid and virtual care to the market. Thank you very much.
Thank you very much for having us. We're